just very concerned about the rising cost of health care, like everyone in this country. As the budget chairman, I have the honor of representing my colleagues in that role, and there's no way we're going to reverse the curse and change our fiscal trajectory that is completely unsustainable if we do not address and bend the curve on the cost of health care. It's crushing our families. It's a drag on the economy, and again, it's a threat to my children's future, and we've got to do something about it. A third of the federal government's budget is health care. 50% of all health care dollars are controlled by Washington, D.C. In the 80s, it was only 30%. Obviously, medical inflation is outpacing all other goods and services exponentially, and it's unsustainable. One benchmark for the American people to get a sense of this explosion in cost, we spent $19 billion in 1975, around 5% of the federal budget. Today, we're spending almost $2 trillion on health care, and it's a whopping 1/3 of the budget, as I mentioned. We've got to do something about it. We have to get the incentives right. We need the partnership with the private sector. I agree with my colleagues, competition, choice, transparency. I mean, no central planning here or anywhere is going to deliver the kind of value that you can deliver if we put the incentive structures in place and guardrails so that everybody wins. But I don't believe that that balance has been struck. I want your expertise, your insurance market expertise on Obamacare, because I do think that one of the problems with these perverse incentives have been directly flow from the creation of these tax subsidy, regulate, mandate programs. This was pitched, sold as the Affordable Care Act. Premiums and deductibles have doubled since the inception of Obamacare. Shake your head up and down if you agree with that. Raise your hand if you agree that they have doubled premiums and deductibles since Obamacare, the inception of Obamacare. Okay, everybody, okay, because it's just math and it's just data. And when you add the subsidy to this from COVID, which doubled the cost to the taxpayer, by the way, didn't double the number of people that were getting this insurance. In fact, if you deduct the 6.5 million people that are ineligibly on the program, maybe it's a third. Do you know how much, on average, the premiums have gone up on the exchange since my Democrat colleagues doubled down on the, quote, Affordable Care Act? Twice. So, Mr. Hensley, is Obamacare, are the cost within Obamacare more or less than the inception, than when Obamacare was first passed? More or less?
Representative, the cost of all health care has increased.
But has Obamacare's premiums gone up twice as much as those in the private market and with employer-sponsored insurance? Have they outpaced the private sector and employer-sponsored insurance plans?
I can't say that they've outpaced.
Well, does anybody know the answer to that question? You don't know the answer to that?
Well, Congressman, in California, they haven't been dramatically different, but I can't speak to it nationally.
Well, we have 6.5, according to CBO, 6.5 million ineligible people that are being subsidized by the taxpayer, that are not legally eligible. By the way, there's also billions of dollars in fraud. There are dead people's Social Security numbers used to send the subsidy to your insurance company. And everybody else up here. My question is, do you know that fact? And if you do, what are you doing to stop it so we can steward tax dollars, so we can make sure that the subsidy, as much as I think the underlying policy is flawed, is at least going to the people that it was intended to? What are you and your company, what are y'all doing to increase program integrity, prevent fraud, waste, and abuse of tax dollars.
Well, fraud-
6.5 million ineligible people.
Fraud is unacceptable everywhere. I'm proud of the work we've done in California, where we've implemented things like dual-factor authentication to verify eligibility. So we have not seen that kind of fraud issue at that level in California. And I'm happy to talk also offline about the things that we've done, I think, that have led to that result. Again, I can't speak beyond our market, but that's our
And
experience
I'm not
in the
picking
market.
on you, quite frankly. It's across the board. Somebody's not putting the controls in place and paying attention. And we've got to change that incentive structure for the sake of the taxpayer and our future taxpayers who would be our children. So with that, I've gone over my time, Mr. Chairman. Thank you. I yield back.
Thank you, Mr. Arrington.